Coming up on Need to Know Rochester, let the shopping frenzy begin. And I'm not talking about false sales at the big box chain stores. I'm talking about shopping for health insurance. We'll discuss everything we need to know about the New York health exchanges before enrollment begins next week. Also on the show, the jobs are available, but specific training for the work is not. We look into the impact vocational education could have on the manufacturing world. Those stories, plus a look at a Fringe Festival showstopper and a new computer program to help improve your social skills. It's all coming up right now on Need to Know Rochester.
Rochester's news magazine since 1997. This is Need to Know Rochester.
Hello, thanks for joining me for this edition of Need to Know Rochester. I'm Helene Bianduti Hofer. So let's face it, the federal health insurance law, the Affordable Care Act, is, in a word, complex. It's received high praise from some folks who say folks with a pre-existing health condition will never be excluded from coverage again. But it's also received a lot of criticism from others who say the law lowers the quality of care. But one thing is clear. Starting on October 1st, more than 50,000 Monroe County residents who are currently uninsured will get to enroll in the new health exchanges. And these exchanges will officially go into effect on January 1st. So what are these exchanges and what do you need to know about them? Well, we've got the experts here to tell us. And I'm joined in the studio by Fran Weisberg, Executive Director of the Finger Lakes Health System Agency, and Trilby DeYoung, Senior Staff Attorney for the Empire Justice Center. And it's great to have you both here. Obviously, a lot to cover, so we'll jump right in. And so under the Patient Protection and Affordable Care Act, uninsured area residents have to buy insurance through these exchanges, these health exchanges. What are they? Break them down, what they do, the process.
Okay, well, I would say that what the health insurance exchange really is a marketplace. It's an online marketplace where people can shop for insurance, find the plan that fits them best, and very importantly, find out if they qualify for any help from the federal government or subsidized insurance here in New York that can help them afford the coverage that's available in the exchange. So it's a brand new opportunity, brand new options for people who right now might find insurance out of their reach.
And is it solely done online? I mean, for folks who don't have computers, which you know does happen, what are options for them?
Well, there are a lot of options. People can work directly one-on-one with an assister, and that could be a navigator, it could be a broker, or it could be somebody who is a certified application counselor. Certified application counselors can be healthcare providers, social service agencies, the local county of social services. There are lots of different entities that can be certified to help folks with their applications. What they'll do is sit down one-on-one with an individual, but that information will be put into an online application by somebody. There's also going to be telephone assistance so that folks can be at home with someone on the phone putting in the information themselves.
And in terms of options, how many are available? I mean, are insurance companies bidding, and how many?
Well, statewide, I think we've got 17 plans. And what happens is different plans enter into different markets in the state. So here in Monroe County, in the Rochester region, which is actually more than just Monroe County, it's got to be multiple counties, we have 5 plans. So we are going to have a lot of options. There are some areas where there's more plans down in New York City. There can be 9 or 10, but we are very comparable to other large urban areas upstate with a choice of 5 different plans, and the plans will have a lot of different products.
Well, as I mentioned, as I mentioned in the lead, 56,000 uninsured residents in Monroe County that will need to sign up starting on October 1st. Right. And I'm just wondering what happens if they don't? I mean, are they really penalized for this?
Yeah, actually, they will be penalized, and I think that's a good thing. I want to step back for 1 minute to talk about why there is an Affordable Care Act and why this exchange is really happening. I've never met one person who doesn't want to get health insurance, just like people want, you know, insurance for their house, insurance for their car, but much more importantly, health insurance. What all of the data shows is that if somebody has health insurance, they will actually not use an emergency room, not end up in a hospital, when they are very, very ill. In fact, people will then have prevention. They will go to their primary care doc. They will really begin, how do I take care of myself better? So instead of there being, you get sicker and sicker and sicker and end up in a hospital bed or end up with a chronic disease, everything says to us if we have at least a minimum of health insurance. So if everybody's insured, and by the way, the second part of it is you need to get affordable health care insurance. So that's what this exchange is all about. It really becomes a marketplace where there's going to be some competition with the insurers so that people can get an affordable price to get health care insurance. And then the other exciting part of all this is that we're going to try to have a sustainable, coordinated system of care in our country that actually values people staying healthier, you know, eating everything from eat well, live well, but much more importantly, the incentives will change away from money every time you go to the doctor or a hospital you get paid to value, keep you healthier in the long run. So they will start paying for outcomes.
And is it really affordable? I mean, is this when we look at the numbers, is it going to be something that low-income families can actually buy into?
I believe it can be.
Yeah, I mean, the good news is the rates that we're going to see in the exchange are going to be the lowest in the state here in Rochester. So that's for everybody, even those who don't qualify for the extra assistance. And lower income folks, anybody below 400% of poverty, will be able to get a federal subsidy, which will bring those rates even lower. And then, of course, people may be surprised to find out they qualify for completely free insurance through the Medicaid program here in New York. Those levels have been expanded up to 138% of federal poverty.
You mentioned some things that they may be surprised with. What do you think are surprising facts with these health exchanges, important things that people may not know, they may not get right now, but do you really want to make a point so that they get it?
There are two things I want to say, and then Trilby, please. Sure. One thing is, many of the people who don't have health insurance work day in and day out, full time, but they can't afford health insurance. Under the exchange, I believe they will be able to afford insurance going forward. So I think there's a lot of misinformation. Secondly, I do believe it will be affordable and there will be subsidies. The most important other thing is if you already have health insurance and you're happy with it, stay with it. This is not something to change something that you already have.
Right. I think that's a really important point that Fran makes, that if you already have employer-based insurance, yes, or if you already have Medicare, the exchange is not for you. Right. You're not going to get any kind of penalty or pay any kind of fee. You can stick with what you've got. But if you need insurance, I think the surprise is going to be that it's actually not going to be that difficult to get it. It's not going to be as complicated as people think. The website that New York State has put together is very user-friendly. It has a seamless connection to information that's available from the federal government. And you'll be able to see what your options are and understand what the choices are much more easily than people think. I would encourage people to go online now.
Yes, Healthy New York?
Go online now, New York State of Health.
We have it on our website.
Right,
yes,
good.
Check
Perfect.
out what the options are. They have a calculator there that will actually let you see what kind of federal subsidies you qualify for. And you'll be able to see what the plans are that are offering coverage here in the Rochester region. So the shopping only begins on October 1st. People have 6 months.
I was going to ask you.
6 months to choose a plan, to find out what's affordable for them. So there's lots of time to make your decisions, lots of help available. I think people are going to be pleasantly surprised.
Let me ask this. I know how states decide to do this can differ. We've got states who the federal government is totally controlling this for them. Some states are partnering with the federal government, and then states like New York are running these exchanges on their own. Yes. What are the pros and cons, in your opinion, of New York doing this on its own?
Well, I think the huge pro for New York is that we have more control and more input over how the system will be designed. And we can make it fit our New York programs. Just one example, we have a program here in New York called Family Health Plus. That's being phased out because it'll be duplicating a lot of what's in the exchange. But New York was able to layer in an additional level of assistance for those parents who would have had more help under Family Health Plus in the past. It'll be invisible to consumers. It'll simply be applied on top of the federal subsidy, but it'll bring premiums lower. We never could have done that kind of integration to help consumers if we had the feds doing this for us here.
Again, Governor Cuomo had great foresight. The governor here was one of the first ones out of the gate to say, we want an exchange in our state. We have 1 million people who will now get health insurance.
Just scratching the surface with both of you. It's so much more to talk about. And I know once the exchange is open, the next 6 months, we'll have you back again so we can dig into this more. Shobi DeYoung, Senior Staff Attorney for the Empire Justice Center, and Fran Weisberg, Executive Director of the Finger Lakes Health Systems Agency. Thank you both so much for joining me. For more information on the New York Health Insurance Exchange, just go to our website, wxxi.org/NTKR. Despite what we hear in the headlines about the job market, it turns out positions are plentiful in specialized fields. For example, the building trades and advanced manufacturing field are still looking for a skilled workforce to help build the local economy. There is a misconception that vocational schools and trades can lead to dead-end jobs. But as Need to Know Rochester's Carlette Clare reports, that couldn't be further from the truth.
It's paradoxical. You got jobs, you have people that need jobs, but we can't fit them together.
Kevin Kelly is the executive director of the Rochester Technology and Manufacturing Association. He's concerned about the widening gap between the manufacturing industry and a skilled workforce.
It's estimated a 40% reduction over the next 10 years among the incumbent workers in the advanced manufacturing sector. So we're losing the current workforce, and we don't have enough candidates coming in to replace them. And so that is a threat to any business operation, not having the appropriate personnel.
Kelly blames a shortage on high schools, who he says are pushing students toward 4-year degree programs to get them college ready.
I think some time ago there was a decision made that we were going to be a service-based economy. And as a consequence, emphasis wasn't placed on the skilled trades, and especially as it relates to manufacturing. And then further along, these programs diminished.
Secretary of Education Arnie Duncan calls the skilled trades the neglected stepchild of education reform. Kelly says his association is fighting back against the decline. They're advocating that students get exposed to trade-focused programs in high school or as early as middle school. Churchfield Chili senior Anthony Jaramillo says he's always had a knack for working with his hands.
I enjoy it a lot. I'm really considering going into this type of field later on in life.
Jaramillo discovered his affinity for precision machining here at BOCES too, after joining the robotics club back at school.
It teaches me so much more that I would learn back at my home school based off the technology classes. There's a lot more to learn, and you can also challenge yourself around based off the other people.
Can you get that out?
Monroe 2 Orleans BOCES officials say interest in this machining class nearly tripled this year. It's part of a new model that combines the welding and machining programs. Edison Technical High School also has its own programs to help with the decline in skilled workers.
Come on, get in there, get in there.
Molly Schley is a STEM counselor for the Rochester City School District. She says during a student's freshman year, they'll explore 8 different skilled trades.
It's our goal every day to make sure that students and families know what's out there, what is after high school. It's not just about what job is out there, but how do we get to the better paying jobs or the jobs that are available in 4 or 5 years or after college.
So you're going to cut right down this line here from the back side. Okay, use a framing square and cut right on that mark from the back side. So put it on the workbench.
I actually started liking carpentry when I got here. If it wasn't available, I would probably try to look into different schools to see if they had other type of programs like this, or look outside of school to see if they have programs similar to this.
In an effort to wipe away the stigma associated with the old vocational schools, they're now being rebranded as Career and Technical Education, or CTE, schools.
Hopefully in this year we'll be able to get our CTE certification through New York State. So we will have in the near future, our diplomas will be CTE certified once our programs are certified through the state.
Just to give you an idea, this is the air pack alone. Oh my gosh. Okay, as he's getting undressed, I'll pass this air pack around. That air pack right there, I believe, is 42 pounds.
I feel like you can't learn unless you do, and we're always doing a lot.
Joseph Foster III is taking a public safety program through Edison at the Rochester Educational Opportunity Center. His long-term goal is to become a pediatrician.
It was a really good choice for me. You get to find out what you like, and there's people pushing you to do other things, like things you never thought you can do. Like, I didn't know that a tactical paramedic existed until recently, and then once I found out, I just fell in love with the idea of the whole process.
Doesn't mean you can't go on with your education. But what it does mean is it allows students to address on a level of training that's been defined as middle skills. Middle skills are those skills which require more than high school, but less than a 4-year degree. A community college program with a 2-year degree or 1-year certificate program addresses that sector.
While a 4-year college degree and an office job still hold a lot of appeal, Kelly says demand for workers in the manufacturing sector will remain strong for a long time to come. For Need to Know Rochester, I'm Carlette Claire.
Testing the boundaries between audience and performer. That's what happens in Anomaly. It's a multi-art show at this year's Rochester Fringe Festival, and it's received a number of great reviews so far. The performance brings together pieces of contemporary classical music, dance, and media projection, and it's all happening inside the Rochester Museum and Science Center Strassenberg Planetarium. And to learn more about this collaboration performance is Emily Wozniak and Drew Warden of the Sound Exchange Project. Thank you both for being here.
Thank you.
So, Emily, you are the executive director of the Sound Exchange Project, Drew, the artistic director. And for this Fringe Fest performance, you teamed up with the local troupe Biodance and also a visual artist, W. Michelle Harris from RIT. And before we talk about the collaboration, I want to learn just a little bit more about the Sound Exchange Project and its mission for folks who may not know.
Yeah, well, I would say at the heart of our mission is to deepen the connection between performers, audiences, and art. And we do that in a variety of ways through collaborations and overall, I think, exploring the creative potential of, say, the audience or a different venue, and exploring what musicians can do in different concert situations.
Tell me about Anomaly and how did this collaboration come about?
Yeah, it's a good question. Sound Exchange has a history of working with both Michelle and Biodance, and the planetarium called Missy, the artistic director of Biodance, and asked her if she would do a show for Fringe Festival, and she invited us, and we thought Michelle would be a great addition, and so the team kind of came together that way.
And I want to know a little bit about the title of this performance, because when I think of the word, I'm thinking about something peculiar. So why this title for this performance?
Yeah.
Well, I think we agree it is a little peculiar, having like a dance group and live projection and music all in this space that maybe doesn't have live elements like that come together very often. And so taking like that inherent quality of the personnel maybe being an anomaly in the space and then trying to input that into the art that we're all making together there kind of guided the way we created the show.
Well, you know, in terms of audience interaction, you mentioned this is a big thing for the work that you do, and it's a feature of the work through the Sound Exchange. I think so often, you know, we go to shows and we sit back and we just enjoy, you know, what we see or what we hear. But how does this performance at the Rochester Museum and Science Center take that experience to a different level?
Yeah, well, I think from day one, Sound Exchange has always wanted to involve the audience in kind of different ways in what we do. And our first concerts, we actually sat the audience in the orchestra. So they were right next to the musicians, so they could feel the energy that we feel when we perform. And similarly, at Anomaly, sometimes the dancers start within the audience. And so the piece will begin, and out of nowhere, dancers will emerge from the audience. And so the audience is kind of brought in to the experience in that way.
And so with this performance is again taking place in the Strassenberg Planetarium, this 4-story dome, and it's an interesting and a unique spot for a performance. So, you know, what type of experience do you want your audience to have, and is there a theme for this particular performance?
Yeah, that's a good question. I think that was a challenge when we set out to program this show. I automatically did not see Mozart in a planetarium, and so Drew had some really great ideas about what kind of music to program behind a show called Anomaly in a planetarium.
Yeah, I think the main thing that guided it is when you walk into a planetarium, maybe there's a certain feeling that you have when you come in, and a feeling of wonder and of the unknown, you know, from maybe experiences that you traditionally have in a planetarium. And so we tried to include that in some of the music that we're doing. So there's a lot of focus on maybe on like flight, you could say, or on like this distance that's between where we're sitting on the ground watching the show and what's happening on the 4-story dome between us. And then a focus on what's happening in between those spaces for the musicians, the dancers, and the live projection.
In terms of a theme or a message, what is it? What do you want audience members to walk away having learned or something of that nature from the show?
Yeah, I think an interesting part of this show is that it's framed with an audio recording that has all of the musicians speaking the definition of anomaly. And I think by now we all have that memorized, but a part of that definition is that it's a matter of perspective. And perspectives are constantly shifting during the show. The dancer might be in front of you or they might be over there. The screen is changing, the music is changing, and I think, at least for me, the point that we really hit on is it's a matter of perspective, and it's a choice how you choose to interpret or perceive different things.
Yeah. So I understand that there is a surprise ending, some type of element at the end of the performance. It's a surprise. Can you give viewers just a little sneak peek or a hint as to what they can expect?
Sure.
I'm not sure how to give a hint without giving it away, but a lot of concerts will maybe end with like a very high energy piece that sends people out like ready to take on the world. I think this concert ends helping people like feel motivated and ready to take on the world, but maybe not with a high energy piece, and with a piece that's maybe a little bit more reflective and intimate and personal in a way, I think. But it utilizes like a very important instrument in the planetarium to achieve that.
What's next for the Sound Exchange project after the Fringe Fest?
We actually have a show next Tuesday at Rush Rees Library, which is something completely different. Some of our other artistic directors are leading a show where they've arranged different music for a smaller ensemble that will be more of a jam session. So it's arrangements of pop music, funk, all different kinds.
Great. Well, Emily Wozniak and Drew Warden of the Sound Exchange project, thank you so much for being here. And you still have a chance to catch this collaboration performance with the Sound Exchange, the local performance troupe Biodance, and visual artist W. Michelle Harris at this year's Fringe Fest. To learn more about Anomaly and other performances taking place this weekend, go to rochesterfringe.com. And this week, world-renowned sculptor Albert Paley's latest work, Soliloquy, was installed at Rochester's Memorial Art Gallery. The 25-foot metal sculpture is the fourth and final piece of outdoor art at the Mag Centennial Sculpture Park. And the piece is made of 7 tons of stainless steel. And Paley says the design process took about 2 years for Soliloquy. You'll find it located near the Goodman Street entrance of the museum. And you can go to WXXInews.org for Paley's entire interview. Well, we all have something that makes us anxious. But if you get stressed at the prospect of social interactions, help may be at hand. A new faculty member at the University of Rochester has created a computer program that offers people the chance to practice social interactions in their own home and get the feedback on how they come across. So the WXXI Innovation Trail's Kate O'Connell has more on this.
Meet Mary.
Hi, I am Mary. I'm looking forward to doing your interview.
Mary's the face of the MARC program created by Ehsan Hawk. The system came about after Professor Hawk received requests from people who struggled with social interactions.
Just relax and be yourself now.
But were unsure about how and where to seek help.
We think the best way you can get help on your social interaction is to get help from another human. So if you have that ability, go do it. But this project, some people may have some fear of social stigma, or they don't want to go take that extra step to get help. Or sometimes when you do desire help, the help may not be available.
That, says Hawk, is where an automated conversation coach can come in handy.
It's extracting all the information about your nonverbal behavior. So it's analyzing every single frame of the video to see where exactly you smiled. It's analyzing every single word you're saying, right? So it's doing speech recognition. And not only what you're saying, but how you're saying it.
While you talk to Mary, your head movements, smiles, voice tone and volume, degree of eye contact, and use of filler words like are all recorded and evaluated by the system. She'll also call you out if you don't pay enough attention to her or let your eyes wander for too long.
Are you still there? I can't find you. There you are. You were saying...
This shows you my smile patterns.
At the end of the interaction, people get to see the breakdown of their non-verbal behaviour during the conversation. And Hawk says that can be revealing.
So as you get all that information, it reveals a lot a lot of things about you. So some students told us that they didn't realize they didn't smile at all, even though they felt that they appeared friendly. But when they looked at the graph, there was no sign of smile.
To demonstrate how the system works, Hawke chose to program it to mimic a scenario most of us have to go through eventually, a job interview. And Mary is the interviewer.
Describe a time when a team member came to you for help.
To assess how effective the MARC system is, Hawke first had 90 undergraduate students undergo a mock interview with a real career counsellor. After sitting through a session with Mary, the students then went through a second interview with the counsellor to see if the system's feedback altered their behaviour.
What we noticed that students who interact with Mary demonstrated better skills on dimensions such as overall improvement. They sound excited about the job. They appear friendly. So this is a situation where you can see they interact with the system and they were able to reflect their behavior as they interact with the career counselor as observed by a third-party counselor.
The next step, says Hawke, is to create a variety of scenarios that can help people in other situations.
So I'd love to try this out in context of helping people who may have some of the social difficulty or Asperger's syndrome. So that's something we're exploring. Other possibilities to helping people with public speaking.
Hawke says the system could also be adapted to train customer service representatives or help individuals with post-traumatic stress disorder assimilate back into society. He's hoping the system will be available online as a free service within the next 2 years. For Need to Know Rochester, I'm Kate O'Connell.
And that's it for this edition of Need to Know Rochester. I'm Helen Bianduti Hofer. Thank you for joining us, and thank you for supporting news and public affairs programming on WXXI. We will see you next Thursday night at 8 o'clock right here on WXXI TV.